So good afternoon. I'm Chris Cooney with the Metro South Chamber of Commerce. Welcome to our 10th in a series of COVID recovery and resources Zoom calls. We're delighted to be recording this and having it available for folks throughout the weeks ahead. This, as well as all of the other calls, have been posted at the Chamber's website, which is metrosouthchamber.com. And there you can find many, many resources, both state and federal, as well as city, posted there and available for you to use and your company to use. We ask you to post all questions that you might have in the Q&A section down below, and we will individually try to answer your questions. I want to thank MLBD and SBA for participating today. We're going to hear from them as well as the mayor before our special guest speakers. I want to particularly thank Susan Whitaker and Margaret LaForest from the Mass Office of Business Development and Susan Laurie from the Small Business Administration for their help throughout all of these weeks and as well as today answering these questions. We've been receiving many questions in the early weeks on business assistance. That then turned into unemployment questions, and now it's return to business questions. And so we have model plans up on that website, as well as considerations that you might want to take into account before you return your staff to work and your customers to your place of business. So I do want to acknowledge some of our partners who have been promoting these calls each week. We're delighted to have a strong consortium of businesses that are working together to get the word out. The Avon Industrial Park Association, as well as the Bridgewater Business Association, the Brockton Area NAACP, the Cape Verdean Association, the East Bridgewater Business Association, the Massachusetts Small Business Development Centers, the Randolph Chamber of Commerce, the South Shore Women's Business Network, and the Stoughton Chamber of Commerce. Delighted to have their participation. I also wanted to acknowledge we have some state reps. As you can imagine, the Speaker of the House is on the call. So we have many state reps. We have Rep. Claire Cronin from Brockton and Easton. We have Representative Jerry Cassidy, as well as Representative Michelle Dubois and Representative Josh Cutler, who represents Pembroke, Hanson, and Duxbury. We're also delighted to have Senator Mike Brady with us on this call as well. So before we hear some updates from city, state, and federal officials, and then hear from our special guest, the Speaker of the House and U.S. Senator Ed Markey, I just wanted to mention a couple things that came to my attention and I was asked to mention today. That is the free testing, the testing that's going on at the Brockton High School. It is available to all residents and businesses in Brockton and the surrounding communities. They're set up there for drive-in testing. A little bit of confusion on that. People asking about whether they'll be exposed to other folks while getting tested. The answer is no. You set up an appointment, you drive up your car, you go into the testing area. I think many of you have seen the videos. It's a very simple process, and you then drive away, and they'll let you know in a short period of time. Of course, the reason we want to emphasize that is because those folks are there in the parking lot under those tents ready to provide the tests, and we know that the data that's derived from those tests will drive business resumption in the state of Massachusetts. So we're encouraging folks to go get tested as they return their employees to work, especially if they have any symptoms. In addition, the Brockton School Department reached out to me. We've been working with them. They've raised over $60,000 for laptops for students that don't have access to computers, and they have done a tremendous job in raising funds. I want to particularly acknowledge Ockers, who was, I think, the first large contribution, as well as Rockland Trust. I know the mayor has been behind this and really pushing it, and had some really great success with the local business community in receiving funds. They are still seeking more funds to buy laptops for students as a part of the solution of distance learning. It's now my pleasure, Mayor, to see you again. This is the 10th week in a row. Happy to see you and work with you closely to get developments and updates as to what's happening in the city as we move along here.
Yeah, good afternoon, Chris and Margaret and Susan and President Clark and all the elected officials on the state level and local level. It's hard to imagine, right? 2.5 months now we've been doing this, 10 weeks every Friday. The response is unbelievable. The information sharing is the whole purpose of why we're doing this. As I've said before, my role as mayor is to, first of all, protect the population in the city of Brockton, and COVID, as we all know, has just been catastrophic and devastating in our community. 2 more people passed, so our loss of life is 234 residents have died because of this nasty, deadly virus, and that's, of course, the sad part of my job. And the recovery is starting to look positive from a healthcare standpoint. We have 1,670 Brocktonians currently dealing, but just a little about 2 weeks ago, we were up to 2,900. So we're starting to see recovery. I literally just got off a call with the hospitals, which is Good Samaritan Medical Center, Signature Brockton Hospital, Neighborhood Health Center, as well as Father Bill's Mainspring. So thank you, Chris, for reiterating and urging people, anybody that wants to get tested. You don't just have to live in the city of Brockton. It's greater Brockton community. Please, please, please don't hesitate. There is that hotline, 844-483-7819. It's on the city's website, city's Facebook, but it is open to anybody and everybody. And I want to thank Sue Joss, Executive Director of the Neighborhood Health Center, and Kim Holland, the CEO at the hospital, because without their collaboration, that would not be possible. And I want to thank the state, EPH and MEMA, and Brockton Emergency Management for working together. I will tell you, the most recent call I just got off, the numbers of testing up there are very low. We're going to do a reverse 911 just to reiterate it, because ultimately, from a business standpoint, if we don't start seeing people up there, they'll try to probably minimize and shift that. So right now, it's Monday through Friday. It is 9 a.m. to 4 p.m., and I would strongly urge anybody that wants to get tested, please do give them a call, and they'll set you up there. Some good news, though, from in terms of economic recovery. The $841,000 we've been waiting for from the feds, it's come in. It's been wired to Brockton Redevelopment Authority. It's CDVG money, and the BRA is our agent on that. And as I've indicated before, as mayor, that money is going to be distributed in a wise manner, but also a practical manner. If you're a business and you did not get either the first round or second round of the PPP, in my humble opinion, you're going to be given first priority. So I'm working with Robert Jenkins at the BRA. We're going to craft a mission on how we're going to distribute that. And also the Brockton Together Fund, as I declared a few weeks ago with United Way. We've gotten some great donations. We're up to almost $50,000. Crescent Credit, Sharon just stepped up for $10,000 donation the other day. So, it's one thing that we've seen, and I know President Clark can attest to this, and Margaret and Susan and Chris, even though right now we're tested like we never thought we would be from a health standpoint in the year 2020, it's people coming together. It's what makes Brockton so special and what Metro South Chamber of Commerce is all about. So I look forward to hearing from, of course, U.S. Senator, our great Senator Ed Markey, who's been a great partner. He's helped me so much as we move through this nasty, deadly virus. And, of course, the wonderful House Speaker, Robert DeLeo. And I want to thank Claire Cronin and Jerry Cassidy, Michelle Dubois, and Senator Mike Brady for their efforts as we continue to navigate the unknown, but we'll get there. So thank you very much.
Thank you, Mayor. I heard recently from Robert Jenkins and Sheila Sullivan Jardim over at the Mass Hire Brockton office in regard to this $500,000 from the federal government CDBG funds that you're designating for small businesses. Our understanding is that it's going to be up to $10,000 grants, and so that money's not going to go that far. But I had a couple calls last week from banks saying, "Gee, we have money still available in the PPP." And I explained that this money is for maybe sole practitioners or self-employed. Maybe they didn't qualify for the PPP because they don't have staff and that type of thing. Also, my understanding is it's going to be women and minority owned enterprises for preferences, and that's going to focus obviously on the city of Brockton and to get funds out into maybe some of the small businesses that have been unable to apply up to this point. So that's great. We'll spread the word on that. Unfortunately, I think they're going to get overwhelmed quickly because there's there is such a need and a desire to get back to business, and all of this, return to business with masks and equipment and signage and all that does cost money, and folks are not seeing the revenue come in right now. So applaud your efforts on that. Any clarification in terms of the timing on that?
Yeah, no, I mean, thank you, Chris. So Chris, you participate in a weekly call I have with all businesses, standing meeting we have once a week. And I have a standing meeting with all the banks. So, and I echo the sentiment you just shared. I mean, the banks are telling me that they have not been fully depleted of the PPP. In terms of the 10,000, that is a threshold that we're going to be working on right now. I do have a conversation again on Monday with Robert and Sheila to try to vet it out further. Then we're going to publicize the heck out of it and get it out and get that money out that will make a difference. But you're right. I mean, it's going to be blown through real quickly, the 841, but at least it's a step in the right direction as we move forward for the new normal, whatever that means.
I also was told that some of that money may be designated for nonprofits. So I just wanted to get that out there. And so people are keeping an eye on their emails.
Yep.
Great, thank you. Then lastly on that, State Treasurer just announced that she's got $2,500 grants that are being made available. And we'll put that link down below as well for those businesses that would like to apply for that. So I'm going to jump right to SBA, and then we're going to come back to the Mass Office of Business Development just for brief updates. Eli, thank you for being with us again this week from the Small Business Administration. Eli, of course, is the liaison with about 125 or 130 banks and financial institutions and working on getting the money out for the federal government. Eli, how are you?
Hey, Chris, good afternoon to you, and thanks for having us once again. I had myself on mute, so I was yapping away and no one could hear me. But I do have an update, somewhat, it's somewhat dated because our updates are now a week old and we're getting them on Saturdays. So the next one will be tomorrow, but it's definitely, it's got some relevant data here that I want to share with everybody, and bear with me a quick second while I share my screen real quick.
Okay, great.
All righty, so it has to be on PowerPoint mode. Everybody is well familiar that this wonderful program of ours, the Paycheck Protection Loan Program, is still going strong, and we still have plenty of funds available. So it's hard to believe that round two is lasted as long as it has. So we still have well over $100 billion of the $310 billion in funding that was made available in round two of funding, thanks to the Congress and Senate who made it available to small businesses, providing us all the tools at our disposal to make this program available to small businesses. And just going through the numbers real quick, as I mentioned, these are approvals through the 23rd of May. You can see in here that it is a phenomenal nationwide. You can see that the dollars lent. I mean, it's remarkable to think that in less than 2 months' time, right? So the program was made available only on April 3rd, and $511 billion is just a big number. But we are still continuing the trend that I mentioned last time with a safe harbor. Some of the larger loans are being paid off early. The good news here is that money that gets paid off early, it becomes available for other businesses to borrow on. So it's not necessarily a bad thing, but we can see the same trend here. The smaller institutions, again, they're leading the charge. About 44% of dollars lent are by institutions less than $10 billion in assets, which is remarkable. Most of our state-based institutions, are part of that group. So that is just phenomenal. And again, this is another breakdown of who's getting loans, what size loans these are. So the bulk of all the loans nationally is $50,000 and under. And truly by units, that is, not necessarily by dollars, but it only represents 10% of the amount lent. But nevertheless, 64% of all units out there. You can see that the loan size has gone down. It was 118,000 last we talked about this. So again, some of those larger loans are getting paid back due to the safe harbor date deadline extension. And just state-specific numbers here. Again, this is the regional stats are a little dated, but the national numbers are, as of yesterday. So you can see the trend again, right? So we went from $511 billion to $510 billion lent, which makes the available funding larger by almost a billion. But Massachusetts, again, in the New England region, leading the charge. There's 105,000 units of PPP loan approvals here in the state for $14 million. And just, fascinating, we have 66,000 economic injury loan advances approved in the state. So about 60% of all the businesses that got a PPP loan got an advance in addition to the PPP loan, which is just remarkable. We did, and those are not numbers we can share, but we did a comparison as to what our per capita, share of this programs were, and it's definitely Massachusetts is getting more money than what population we've got, which is just phenomenal. And again, I do have some data here for the EIDL program, the Economic Injury Disaster Loan. This one is going strong. I've got great news here. Again, data is not as current. It is as of last Friday. Again, our updates are happening once a week and on Saturdays for whatever reason. But interestingly enough, in here again, Massachusetts is getting a pretty good, share of that pool of funding as well. And I pulled a report this morning. Obviously, I cannot share those numbers, but we're well over 10,000 economic injury disaster loans in the state. So truly, I think here we're making the most progress. We're seeing approvals of 500, 600 units a day, which is not quite the same as the PPP, of course, on the economic injury disaster loan. But, the program has picked up, pace, and we're seeing that same, steady number of approvals day in and day out. So just one, you can see here that, there's 10,000 or so units approved, but 66,000 small businesses got an advance. So all of those businesses are still in processing for the economic injury disaster loan. They will receive, a decision, not necessarily a loan. Some may not qualify because the EIDL loan is a little more stringent as far as underwriting as the PPP loan program. But good news all around. Again, for folks, any questions that anybody has, our website is a great resource. But in addition to our website, the Department of the Treasury has all the program rules, listed in one page, and that is home.treasury.gov/cares for the CARES Act. So don't want to, extend my welcome, but I'll turn it back to you. And thanks again for having us.
Thank you, Eli. Thanks for the update. We really appreciate your consistent communication with us, as well as Bob Nelson, of course, and Susan Laurie. Been a great team and been hugely supportive of the business community in this region. Now I just want to go quickly to Margaret LaForest. Margaret is our representative for Massachusetts Office of Business Development. She also serves as our liaison for the Regional Economic Development Organization initiative that we've been part of for many years. Margaret, how are you? I know you're a former city councilor and all kinds of good stuff that I can't really talk about because of time, but you've been on the call consistently and we're happy to see you back. So.
Thanks, Chris. I actually have some very great hot off the press info to share today. We just had our 1 o'clock call with Secretary of Housing and Economic Development, Mike Keneally, who oversees our agency. And the governor is actually live. Can you believe he's coinciding with the Metro South Chamber call? But the hot announcements that he's sharing, I'm able to share with those tuning in here on phase 2. So this afternoon, or right now during this press conference, the governor is releasing the sector-specific protocols for restaurants, accommodations, and the hospitality industry that have been long awaited. He is announcing that they are going to be starting when phase 2 starts. They're allowing outdoor dining first, 6 feet between tables. They did not put a capacity limit, and they did not require reservations. So for all the restaurants out there, I know that will come as a big relief to get that information. Also, on Monday, he'll be announcing his executive order that for phase 2 businesses, they will be able to start to bring their employees back to be prepared. And important date for you to all put in your calendar, June 6th. June 6th is the date, and let's be clear here, this is the date the governor will announce the date that phase 2 begins. So June 6th is not the date we're starting phase 2, it's the date we are announcing the start of phase 2. Okay, so a lot of good information coming out. I'm just going to share one quick slide with what actionable items we need businesses to take. I know that Emma had put some of that in the chat, but I'll be very quick with this. Okay, hold on 1 second here. Where are you? Sorry, had it all keyed up, ready to go. Here we go. This is going to be our phase 1 summary. And I want you to look at the right side. Did that not come up?
It did, but then it went away.
All right, let's hit that again. I'm sorry, I'm usually very good on this. I'm gonna go from beginning.
There it is.
You can see it?
Yep.
Now it's gone.
Yes.
Well, I'm just gonna leave it on that one quick. I just, I see that it's a little cluttered. You'll see it in within the screen. And I just want you to look on the right side. This is what you're looking for. Mass.gov reopening. This is what's really important for all businesses, whether you're phase 1, phase 2. The COVID-19 control plan template, and Emma put the direct link in the chat. This is what you need to be completing. The compliance attestation poster, it's a self-attestation that you've completed your control plan template. You're going to hang this in a very visible location so that your employees, as well as your staff, your public and your customers see that you've completed this plan. And it's really a message that you have made safe accommodations to reopen your business and help building the confidence of the consumer as well as your staff, and the employer and worker posters. So the mandatory safety standards we've been talking about a little bit, but what's really important is these sector specific protocols have some requirements that are mandatory in there, and each of the different sectors are having their guidance released. So look, each day we're rolling out as soon as the guidance is ready, additional sector specific protocols. So just quick, what we have out so far, we have like construction, manufacturing, laboratories, salons, and drug groomers and drive-in theaters, outdoor recreation. I mean, there's a lot of sector specific protocols. So my advice as to navigating this is, one, we get it's a lot of information and a lot of content out there. mass.gov/reopening. Scroll down, when can my business reopen? Click there, it brings you to all of what phase you're in and links you to the protocols for your industry. Sue and I are always here for you to help you navigate that. I'm happy during Q&A to field if you're trying to understand the guidance, when it applies to you, how to interpret it. Reach out to us. We are there to get you the answer, to expedite the answer if we do not have it. Other one that was clarified today, I know many are advocating the outdoor fitness. If it's 10 or under, you're in your socially distancing for an outdoor yoga class, that is a go. Just a clarification, some of that guidance came out this week. So I know we have some, welcome to have some guests with us this week. We'll keep our updates very brief, but happy to answer Q&A in the chat.
Thank you so much, Margaret. There was another question from the tent industry, especially as it relates to businesses in our area, where restaurants want to rent tents, take the sides off so it's a canopy, and then position tables 6 feet apart. Is there clarity on that?
So I think you're going to see that being announced today. Governor Baker did say that outdoor dining is going first. I know a lot of the municipalities are working to make outdoor accommodations when a restaurant doesn't have their own patio space. So I would say touch base with Mayor Sullivan as well as your local inspectional services department for outdoor tent setups. Some of the municipalities are kind of designating a municipal parking lot, maybe putting a larger tent up that some could share, really depending on the setup. So the guidance as to what to expect for the protocols for the restaurants to follow is coming out today. I don't have the link. I did just search. I'm sorry, I'm texting during the call as I'm getting intel from the Gov's announcement coming in as we speak. So I don't have that yet, but yes on the outdoor dining first. And I think Inspectional Services and Mayor Sullivan would best handle what's best for Brockton. And I know we're a regional chamber, but so municipalities may be hearing different, but typically
right. So what we're hearing from fire chiefs is that they're not going to let the tents or canopies be erected until the state says it's okay. So that's a spot where I think Lieutenant Governor or the Secretary could really help, because there are many folks that do put up tents anyway before all of this, and now they don't want to incur the cost if they can't have anybody sit underneath it. So, and I just want to kind of bring that to you.
No, understood. We appreciate that you sent us that advance question. The guidance is forthcoming, and as soon as we do have it, but yes, we're anticipating, just what the tent protocols are within local permitting, what size of the tent are. There's a lot of variables to that question, but happy to work with inspectional services and see if there is some clarity upon that, and it could be released within this afternoon.
All right, thanks so much. I want to thank Susan Whitaker too, who's also your partner on the MOBD that's on the call. Thank you, Susan. So now it's my pleasure to introduce the chairman of the Chamber's board, Fred Clark, who's also president of Bridgewater State University. Bridgewater State University has more than 10,000 students enrolled and is the 4th largest public university in Massachusetts. Although it is known for its distinct and quality preparation for school teachers, which many of my school teachers were graduates of Bridgewater State, it also prepares many other majors. And just two I'll highlight is their accounting program. It's got the highest pass rate, first-time pass rate at 61% of any CPA program, public or private in Massachusetts. It also prepares many pilots for their pilot's license through their FAA-approved flight education. So just a really great resource with many staff also on board there, and an economic impact that is equal or rivals most of our private industry. So President Clark, welcome. You take it from here.
Chris, thank you very much for that ad. It's better than I could have written it myself. I appreciate it. Thank you for your leadership, Chris, through the chamber and as a distinguished citizen of this region. I have the pleasure today of introducing our two next speakers. And I want to start with the Honorable Speaker of the House, Robert DeLeo. And I want to say, Mr. Speaker, I was talking to a former colleague of yours, Senator Vinnie DiMacedo, who works with us now, and we were talking about how difficult of a time it must be, a challenging time to be an elected representative. And I wanted to let you know, and the representatives that are on this call, the mayor, the senator that are on the call, how grateful we are for your service at this critical time. And with that, I would like to say that House Speaker Robert DeLeo has represented the town of Winthrop and a portion of the city of Revere in the Massachusetts House of Representatives since 1991. Speaker DeLeo is a leader in clean energy, marshaling support for the adoption of many landmark initiatives and making Massachusetts #1 in energy efficiency in the United States of America. Speaker DeLeo's priorities include job creation, fiscal management, and education. And on education, I will let all of you know, he is a very good friend to Bridgewater State University and to Massasoit Community College as well. Recently, the Speaker helped secure a $1 billion 10-year investment in addressing climate change, known as GreenWorks. Mr. Speaker, thank you so much for joining us. I hope that you and your family are doing well and being safe. You've had such an amazing run as Speaker. Keep it going. And thank you for making the positive change that you've made throughout your career. Now, in this coronavirus situation, we want to hear from you about where do you think we go from here to get back on track for the state of Massachusetts? Mr. Speaker. I don't know if the speaker, Mr. Speaker, if you're talking, your mute is on.
All right, we might want to pivot to Senator Markey.
Can you hear me now?
Yep.
Oh, there you go.
Speaker, you look great.
Okay. Thank you so much, Mr. Chancellor, for that very kind introduction. And thank you for the great job that you do, by the way, at Bridgewater State. Thank you, Chris, for your moderating today's event, and to my fellow speakers here as well, Eli and Margaret. Of course, Mayor Sullivan, who I've had the opportunity already to meet with and to talk about some of the concerns relative to Brockton. He has not been shy at all in making sure that I knew whether pre-COVID-19 what the issues were in Brockton. And of course, my good friend Ed Markey, who I've known a number of years, is prior to his role as a U.S. Senator, he served as a congressman for my particular district, and we always work very, very well together. We're all doing things a little bit differently now, and I'm grateful to have this opportunity to speak to you, even remotely. We have all had to pivot and to adjust to this new reality that we find ourselves in. First, I want to thank Bridgewater State, along with Chair Cronin, for your help in translating the important message on domestic violence. I want to make sure that everyone realizes what a help that you have been relative to that subject, and want to sincerely thank you, State College and University, I should say, and Chair Cronin. Finding a way to incorporate our traditions and perform vital functions while addressing new challenges is something we are all now doing. When the pandemic struck, the House took prompt action to pass emergency legislation to address key needs for the municipalities, providing flexibility on MCAS requirements, giving relief to tenants and to homeowners, allow remote notarizations, and create new tools for restaurant owners, such as allowing takeout alcohol. In today's news by the governor was very welcoming as well. We've had to refashion the practices of our institution to hold the first ever remote formal session here in the House in almost 400 years. Moving the tax deadline required a formal borrowing measure and a so-called formal vote. Employing the ingenuity that our institution is known for, we figured out how to do it while prioritizing public health and meaningful access for House members. None of this is easy, but it's necessary. I'm grateful to my colleagues in the House for their steadfast work and energy during this crisis. I salute the members of your delegation, who you all know represent you exceedingly well up here at the State House, including Representatives Cronin, Representatives Cassidy, Dubois, Senator Brady. I think Representatives Chan and Cutler may be there as well. At least those were the names that were given to me. I hope I'm correct in that. And I also want to mention, even though he's a former Senator, DiMacedo, he is a very good, and continues to be a very good friend. I want to thank you for their efforts, or thank them for their efforts, I should say, during this incredibly difficult time, when new challenges, I would say, seem to crop up on a daily basis. I especially want to thank all of our essential employees, our first responders, our grocery and cleaning workers, public safety workers, and of course, our great medical personnel. These are the people who courageously make sacrifices to help heal others. Last week, Governor Baker announced the administration's plans for reopening Massachusetts, and each day and each week, I guess you could say, that becomes a little bit more that is known in terms of what our timetable is for certain businesses. And I know most of us have questions about the specifics, metrics, and enforcement mechanisms. Our governing system leaves to the executive the job of closing and opening the economy in the wake of emergencies. It is the role of the House, however, to put Massachusetts in the best position to work its way out of this unprecedented challenge. To facilitate this process, I've asked Majority Leader Mariano and Assistant Majority Leader Wagner Mariano to chair and Wagner to vice chair, the Commonwealth Resilience and Recovery Special Committee. This group of House members will work together to identify the state's key legislative priorities as it relates to our recovery. While the normal legislative process continues stronger than ever, and our chairs are hard at work vetting bills, the special committee will be a place where we'll be able to convene broader discussions and think through the interdisciplinary policy ideas. The House Committee on Ways and Means, first of all, continues its work on the budget. The present fiscal picture right now, I'd have to say, is entirely different than what it was when we first started the hearing process back in December. And then the governor submitted his budget in mid-January. In April, at the Ways and Means Economic Roundtable, the provided estimates of potential revenue loss were from anywhere from $2 billion to $6 billion. And I'd like to also point out that recently the Mass Taxpayers Foundation downgraded their estimate from $4.4 billion to $6 billion. So this may be the first of others to come on board to talk about the continued widening, shall we say, of the tax revenues that we see happening here in the Commonwealth. And I'd have to say, obviously, these numbers do not look good. In addition to that, our unemployment claims in Massachusetts has climbed to more than 1 million since the start of the crisis. And some evidence has suggested that the unemployment rate here in Massachusetts could reach as high as 25%. April state tax collections, meanwhile, were more than $2.3 billion below last year's collections. And even with that number, it's uncertain as to how much is attributable to the state's income tax filing deadline from April to July, and how much is the true economic slowdown. In just 1 month, revenue has taken us from a budget surplus to a budget significant shortfall. We don't yet know how much help we will be getting from Washington. That news has varied somewhat. We went from dead on arrival to, well, we're taking a look at some of the maybe doing something in the future. So right now, that's still a big question mark in terms of what are the help we may be getting from our folks in Washington, despite the great efforts of Senator Markey and Warren, our congressional delegation. What I do know is that the chair of the House Ways and Means Committee, Representative Michaelwitz, is diligently engaged in talking to House members, stakeholders, experts, his counterparts in the Senate and the administration, striving to put together a plan that will allow us to meet this great fiscal challenge. He has done a remarkable job, I'd have to say, under these circumstances, showing a steady hand and great discretion, and I want to thank him personally for that. When that process nears completion, we will have a better sense of your particular chamber's priorities, such as the Regional Economic Development Organization grants. Even as we work to meet these tremendous fiscal challenges, we remain committed to our core principles in supporting folks as they navigate remote work. We all understand that a key component of any recovery is access to safe childcare. EEC has been a priority of the House over the years. Our early education and care business advisory group has made key recommendations, including a multi-year action plan for targeting investments that strengthen our EEC efforts in Massachusetts, which resulted in the House providing some $60 million, an unprecedented increase to support the workforce and improve programs for the most at-risk children. To help providers address the challenges of COVID-19, Chairs Paish and Ferrante are spearheading a newly formed Early Education and Care Recovery Advisory Group to help businesses and providers make sure that they are prepared to support families and workers in this new landscape. This group will look at how health protocols will impact childcare, examining the financing models for programs amid numerous changes, and explore the effects of the pandemic has had on programs in communities of color and those throughout the sector. We all know that unless we are able to begin a process of getting our child care facilities back into a functioning mode, that it's going to be very difficult to see our economy and businesses begin to proceed forward in these difficult times. But just as employees need to understand how the pandemic is changing childcare, they also need to see how it will affect their transportation options, including access to safe and reliable public transportation. It may seem like a long time ago, but this session, the House of Representatives was proud to take bold action to raise much needed revenue for our transportation system. Many warned me at that time that taking a tax vote would be politically difficult, but the House never shied away from tough decisions or heavy lifting when action is necessary. I was so proud of the work of our team on this one, whether it was Chair Strauss, Chair Michaelwitz, Leader Mariano, or Chair Cusack. They spent months upon months hearing from members and stakeholders to build a plan that worked for the entire Commonwealth and for residents and employers with diverse needs. And the overwhelming vote in support of that plan reflected the strong agreement by our colleagues that this was the right thing to do. We all know what happened. After about a week after we voted on that plan, and we're very proud of what we had done to move our transportation system forward. And when I talk about transportation, I'm not strictly talking about the MBTA here in Greater Boston. I'm talking about the transportation needs for folks all over the Commonwealth of Massachusetts, including obviously the Regional Transportation Authority, which has been made clear to us by the representatives throughout the state about the important role that they also play in transportation throughout the state. But about a week later, after we had passed that, our ground shifted under our feet. The pandemic led to an historic drop in ridership and public transit and a vast reduction in traffic congestion almost overnight. But make no mistake, the transportation problems and infrastructure needs remain, and we are now thrown into a sharp focus as the state begins to reopen. Like you, I share many questions about the transit aspect of the reopening plan. And my office in ongoing conversations with Chair Strauss, the Chair of Transportation, as we pass through the details of the outline. We understand and we recognize that the plan is designated to be iterational, yet questions persist. With schedules changing along with the administration's phases, our workforce relies on mass transit. It needs to have confidence that the transportation system will be safe and that it will be reliable. We need details about the social distancing and related matters that reflect immediate transitions in ridership and demand, as well as the long-term requirements of preparing our system for full return to our state's economy. And I recently have had the opportunity to speak to our Secretary of Transportation, Pollock, who talked to me, about the plans to get the transportation back moving as our economy starts to move as well. So this was welcome and good news as well. In addition to that, we'll be focusing obviously on the T and the commuter rail's efforts to have a workable system amidst a public health crisis. We know that we can't take our eye off the board when it comes to capital planning and long-term revenue plan. Our plan is now awaiting action in the Senate. While the focus is now on timing and implementation of changes, the House is committed to a thoughtful strategy for long-term needs of our transportation system. Central to our economic recovery, as I think you probably had mentioned, or some of the folks earlier had mentioned, are the prospects of small businesses. No corner of the sector has been more affected by the pandemic, I think, than our restaurant. And I think that's why Margaret probably highlighted that. Obviously, it was a great announcement today by the governor, but what I've heard, I think, in every city and town in Massachusetts has been the effect on our restaurants. even before the pandemic, supporting our restaurants, I'd have to say, was really a concern that we had in the House. As a matter of fact, last year in our budget, we announced the creation of the Restaurant Promotion Commission, an entity that we created in our budget. And we had done that because of the fact that what we saw was an industry that we felt probably wasn't living up to its full potential. And we wanted to talk to the Restaurant Association and restaurants throughout the state in terms of how we could do a better job and making sure that we were getting the most, both economically and obviously our constituents were getting the most out of our restaurants here in Massachusetts. With the help of Chair McMurtry of Dedham, that group was actually ready to release its plan back in March. Again, then COVID-19 upended everything. Given that, the Commission's mission is more vital now more than ever. We will repurpose this group as the Restaurant Recovery Commission to provide a voice for restaurants throughout the state as they confront the challenges of social distancing and life in the wake of COVID-19. Chair Michaelwitz is working with Chair McMurtry and Chan and Vice Chair Day to prepare a legislative restaurant package that we hope to be taking up hopefully within the next couple of weeks. And what we plan to do, in addition to what the governor has announced today, is to talk about the waiving of the meals tax interest on late payments, ease outdoor dining restrictions, which I think was referred to earlier again by Margaret, expand alcohol delivery options to include mixed drinks, extend the takeout options to the end of the year, and cap the amount that can be charged for food delivery services. What we've heard consistently from folks is some of these food delivery services charge anywhere from 20 to 30% in terms of delivery of the food from the particular restaurant. And if you're talking about a relatively small margin of profit, shall we say, of our restaurants, taking out an additional 20, 30% makes life a whole lot more difficult for these restaurants. But I think it is important for us to work with our restaurants, so when this is over, we will have a healthy businesses to provide jobs for our residents. As we take the long view of the crisis, we have been battling, we have faith in our state and its foundational industries, such as manufacturing. Whether it was during the days of Brockton's great shoe factories and mills at the foundation of the industrial age, computers and defense post World War II, advanced manufacturing in the wake of the 2008 economic downturn. Massachusetts has played a key role in the national and world story of manufacturing. The House of Representatives has been proud to be part of that storied history, and we will be proud to lead in the future. When challenged, Massachusetts manufacturers has always answered the call. At peak production during World War II, when America faced Japan and Nazi Germany, for example, the Fall River shipyard could produce an aircraft carrier in 14 days. The House has historically championed Mass MEP, which has received $2 million annually in our budget for many years. And we look forward to support the partnership efforts as it helps manufacturers in today's fight and in tomorrow's as well. There is no question that the challenges surround Massachusetts right now as we fight two battles simultaneously. A battle against COVID-19 pandemic and a battle to restore our economy. Even with these changes, we have faith in the resilient spirit and innovative core of our state. I know that your local hospitals, such as Signature Healthcare Brockton, Good Samaritan Medical Center, as well as your local community health centers, have been leading the fight on the front lines against COVID-19. Facilities such as these and the healthcare workers they employ deserve our utmost respect and support. We know that the healthcare industry continues to struggle with the influx of patients, ensuring the safety and well-being of its employees with insufficient access to PPE and medical supplies, and with the limitations of medical practice. We know that to maintain stability within the healthcare industry will be a key piece of our recovery process. Our healthcare institutions and universities have not only stepped up in a major way for the residents of the Commonwealth as the virus has ravaged communities, but they've also been on the cutting edge of research and best practices for how to tackle this disease. Massachusetts is still America's laboratory of ideas. I am confident that somewhere in the labs and work spaces of our region, there are ingenious scientists and tech staff, including those in trades and trained in the life sciences program at Bridgewater and at Stonehill, who may find the key to unlock treatments or perhaps a vaccine to fight this virus. We helped this incredible life sciences cluster flourish in our region, and it has the promise to rescue the world. It was not an accident. It took imagination, creativity, and persistence, but that should be no surprise to anyone. One could wonder how I can be so confident in our region, in our state, when things look so grim, especially with some of the figures I mentioned earlier. I was elected during a time of a fiscal crisis followed by a recession. I served in the House during the dot-com bust and 9/11. I became Speaker during a low point of the financial crisis in 2009. Each and every time, I have seen us take a step back, work together, and confront the challenges. I have faith, and I know in my heart, we are Massachusetts, and we will be back. I thank you for your attention here today. I want to ask God to please protect and bless the Commonwealth of Massachusetts, the United States of America, and as we have just made note of our Memorial Day services, may God bless those who fought to keep our country free. Thank you very, very much.
Thank you, Speaker DeLeo, for your friendship, for that informative, hopeful, and inspirational set of remarks. We know you have quite a challenge in front of you. We also know that we have one of the most effective legislative delegations here in this region in the state that you rely upon. But let me offer on behalf
I'll second that.
Yes. Let me offer on behalf of the Chamber, anything you need from the Metro South Chamber of Commerce as you navigate these choppy waters, please, we want to be your partner and friend. Don't hesitate to call upon us. Thank you
very much, Mr. Chancellor. Thank you.
Thank you, Mr. Speaker. We know you have to run. And again, thanks for being with us. Be safe.
Thank you. You too and your families.
We have our wonderful United States Senator with us, Senator Ed Markey. Thank you so much, Senator, for being with us today. We're really grateful to have you with us. We have kind of a state perspective we just heard, and we're going to have a federal perspective, and everyone working together can help us through. I do want to acknowledge, before I introduce you more formally, that your staff person, Jim Cantwell, is here. And Jim is on speed dial for all of us. We rely on him heavily. And I do want you to know, Jim and I go back a long way from my time when I worked for Congressman Moakley and he worked for Congressman Delahunt. And all I remember, we played softball all summer long, and all I remember about Jim Cantwell is him running into the woods to get our home run balls from the Moakley team. So anyway, but it's good to have him. It's great to have you. And let me just more formally introduce you, Senator Markey. Senator Markey is a national leader, as we all know, on clean energy and the environment. He serves as chair of the Senate Climate Task Force. He's a member of the Environment and Public Works Committee, Commerce, Science, and Transportation Committee, the Small Business Committee, Foreign Relations Committee as well. He most recently co-authored the Green New Deal and is a leading advocate to provide protection, relief, and support for COVID-19 frontline workers. Senator is clearly a national leader on telecommunications policy as well. He has an absolutely prolific legislative record on major issues across the policy spectrum. and a deep commitment, as we all well know, to improving the lives of the people here in Massachusetts and across our great country. I do want to say, again, with my Joe Moakley hat on, like Congressman Moakley, he's a man who never forgot where he came from, and we're grateful for that. So thank you for being with us, Senator Markey, and we wonder if in your conversation with us today, you can also talk about the timing of the stimulus discussions and what came out of the House in terms of its thoughts and what the Senate may do with that House bill as we move along. Senator Markey.
Thank you, Fred, so much. Thank you for all of the great work which you do at Bridgewater State University. I think just 1 year ago, I was the commencement speaker at Bridgewater State University, this incredible gathering of fantastically talented young people all heading off into the world. It was just an inspirational day for me, Fred, to be there, a great honor. And it's a shame that young people this year will not have that same experience, but the one thing they will have is the fantastic education which they've received at Bridgewater. And I just want to thank you for just being a leader that has really helped to turn this institution into just an incredible star that parents can look to make sure their children get all the tools they need to be as successful as they want to be in whatever field they want to go to. So thank you, Fred, and thank you for the honor of speaking there last year. And you are right, Fred. Right now, like Joe Moakley would be doing, if Joe could figure out how to work Zoom, Fred, which we would help him with. I'm here in my dining room in Malden, in the house I grew up in. You know, my father drove a truck for the Hood Mill Company. My mother was a senior class president, but her mother died senior year. So she had to basically give up her college dreams and just stay behind and raise the 3 younger daughters. That's the way it was. It was compounded by the fact that, honestly, she had the last rites when she was 12 because of the Spanish flu of 1918. Her father, Patrick Courtney, got off the boat with his brother, Dennis Courtney. Dennis Courtney died in Malden because of the Spanish flu of 1918. My mother had the last rites. And that was clearly a traumatic event. And now what we're seeing is a confluence of the 1918 pandemic and the Great Depression, which also had a profound impact on my family, my mother, my father. I mean, my father graduated from Lawrence High School. He grew up on the first floor of a triple-decker in Lawrence. And the Lawrence Savings Bank went under in 1930 with all the money that they had saved in the Markey family. And I know that that had a profound impact on that generation of Markeys off of the first floor of a triple-decker in South Lawrence. And so right now, families are facing both the pandemic and the Great Depression hitting them. And so it's great, this incredible gathering that you put together. Fred, Chris Cooney, thank you so much for all of your great work in organizing this. And to Eli and Margaret, thank you for your wonderful outlines of the programs that are out there. And to Mayor Bob Sullivan, my great friend, we've been talking along the line here in terms of all of the things that are needed to be done in order to give help to Brockton, give help to the cities across the Commonwealth, and to our great speaker, Bob DeLeo, who just laid out, I agree with you, Fred, a phenomenal outline of the things that are being done, but also need to be done in order to deal with this incredible, unprecedented situation that we are in right now. So just in talking to Mayor Sullivan over the last several weeks, one thing I learned was that at the top of their list was community development block grant money. So Brockton got $841,000 out of the package that we passed about a month ago. That is left to the discretion of Mayor Sullivan to spend in any way that he thinks is best in his judgment, and he's laid that out. We also talked about the need for more PPE, more testing, more contact tracing, and that's something, you know, in partnership with him and the medical institutions down in Brockton, we worked together to try to make sure that there would be additional resources that would be there. But we also know at the same time, there's still a lot of work to be done to make sure that we can reopen, to make sure that we can do this safely. So what we tried to do in the first couple of packages, which we passed down in Washington, is make sure the hospitals got what they need. So in the first package, $150 billion, 150 went in for hospitals. We made sure that people got an unemployment check up through July 31st, $600 a week on top of their state benefit. So people would have money in their pockets. And we want to extend that. The Democrats want to extend that out to December 31st of this year. You heard the mayor talking about unemployment rates that could rise to 25%. And that's the depth of the Great Depression. So let's try to figure out how we get that unemployment insurance into the hands of people so that they can predictably for the rest of this year know that they're going to have help. And in addition to the $1,200 that we built into the first coronavirus package that went out to everybody, this new bill, the HEROES Act, has $1,200 in it as well for a second shot of money that would go to everybody. My personal belief is it should go up to $2,000 per person. And we should do it on a recurring basis until we are out of this pandemic so that families know that they are going to have the money in their pockets to be able to pay for the mortgage, for the rent, for food, for prescriptions, for all the other goods and services that that people have to have in order to survive. Excuse me. And the original package as well, the one that we did 5 or 6 weeks ago, it built in $270 million for educational funding, some of which went to Bridgewater State. But we need to do more. These schools are going to be facing unprecedented challenges, and we have to make sure that the revenues are there to help them moving forward. $275 million was a good start just from Massachusetts. It was about 12 or 13 billion for the whole country, but we don't want to see a collapse of our educational system in the country because of this challenge. We have to provide the revenues. We also, in the second package, we said to the president and to the Republicans, we need another $75 billion for community health centers in Brockton, across the state, across the country, and more money for hospitals as well, so that they're able to make it through. Many of them are hemorrhaging revenues. They weren't able to take in many of the patients that they would otherwise. And as a result, their revenues have just collapsed to a certain extent. And we have to make sure that we give them the help that they need from the federal government to be sustained throughout this pandemic, because we need the healthcare institutions, the hospitals and the community health centers to be there. There could be a rebound. There could be a second wave this coming winter. We have to make sure that they're not laying off nurses, laying off medical personnel, but keeping people there, getting ready for the implementation of the lessons which they're learning here in this first round. So we actually had a tough battle in the last round to get the president to accept the additional $75 million, which we built in. It took about an extra week to get that package finished, but the money did go in. There was an additional $25 billion that we wanted to add for testing, because we were being told by all of the experts, and I did talk to all of the hospital leaders and community health center leaders down in the Brockton area at the suggestion of Mayor Sullivan, and they were all talking about how that's the key. Well, it's not good, but we actually had to fight for a week to get that $25 billion for testing. And that money went in. So thank goodness that money is going to be able to go out and into the system as well. But we know we're going to need billions more in testing and contact tracing. It's going to be very expensive, very, very expensive to have enough testing on an ongoing basis that gives people confidence that they can send their kids back to school, back to college, that they themselves can go back into a workplace. It's going to have to be a very, very grand plan that we have for this. We have to think big. And if we don't think big, we're going to wind up going right back to where we were. And because we'll just be making a mistake that we know that was avoidable. So when people say to me, well, when are we going to go back full time? Well, it's not a question of when, it's a question of how. And that question can only be answered, how is, do we have enough PPE to go all the way back? And right now the answer is no. Do we have enough contact tracing? The answer is no. Do we have enough contact tracing? The answer is no. So that has to be funded. The federal government should be playing that role. And we should be saying that's the best way to build consumer confidence. If the consumer knows that it's safe, then they'll go out. They'll go shopping. They'll use the businesses. You can open the businesses, but if there's no consumer confidence, it doesn't make any difference. And so from my perspective, we have to provide that federal funding. So we're going to be having that debate in this next round. And Fred referenced it in his introduction to me. So there's a $3 trillion package, which has now passed out of the House a little more than a week ago. And so far, Mitch McConnell has refused to have any hearings, refused to have any negotiations in order to put together a package which we can present to the American people. Now, from our perspective, and this goes to my conversations with the mayor, he wanted more community development block grant money. And I agree with him. That $841,000 should just be the deposit. We should come back again and get even more money. So what the Democrats are proposing, because the cities and towns are hemorrhaging money, is that we put in $875 billion for the states, for the cities, for the towns. So the mayor has the resources to help his medical institutions, to help small businesses, to provide food for people who are desperate in Brockton, for nutrition for their families. We're at unprecedented levels of food insecurity in our country. And think about this, it's already on top of the reality that 50% of all children in America at some point are on SNAP. 50% are already at some point in their life on SNAP. So if that starts to get exhausted, or we don't deal with the reality that there's upwards of a 10, 20, 30% demand and increase in the price of food, then we're going to see some real suffering in this country. So we have to deal with that as well. And we need more money for hospitals. We need more money for testing. We need more money for contact tracing. We definitely need more funding for PPE and high quality PPE, you know, N95 mask level PPE, so that people feel more confident, and we just have to get it done because we know that's going to be a prerequisite to anything that we do. Now, you know, we work in partnership with the state, with the governor, with the state legislature, and the speaker does a great job. And he already mentioned Senator Brady and Representative Claire Cronin and Josh Cutler, Jerry Cassidy, Taki Chan, Michelle Dubois, just an all-star delegation working in that region in order to be advocates for our state to do the right thing. And we're going to have more of that. Massachusetts is the Bay state, but we're also the brain state. So we have to figure this out. We're only 2% of America, but we are the innovation economy. And that's where young people want to go, into something that deals with technology, something that deals with It's science, something that deals with things that are their life, their future, how they see themselves. And that's going to require a lot of cooperation, federal, state, and local. So in answer to your question, Fred, thus far, Mitch McConnell has refused to negotiate, but he's gone from saying, no, never, why would we be helping blue states, we're red states, to now seeing a new map where all the spikes are in red states, and a lot of it is because they're not abiding by the public health warnings that were received from Tony Fauci and from many others. And I think that we're going to have a real battle on the floor, maybe the biggest battle of my entire congressional career over this issue of more help for people who are unemployed, more help for everyone getting a $1,200 check, more help for the cities and states getting upwards of $1 trillion so they don't have to lay off police and fire and teachers and cut back on schooling and healthcare and food for the people in their communities. We're about to have an incredible battle over this, and we're going to fight them every single step of the way. My own belief is that the president would have a hard time vetoing the HEROES bill. That would not be a good message to be sending to the country, especially as we're heading into a deep, deep, deep depression. That's what economists think is going to happen. The only way out is if we start out where we know we should start out. But we should not be forced to have to start out there. We should just do it. We learned the lessons in the 1930s. We learned the lessons from what happened with a laissez-faire attitude from Herbert Hoover for 4 years, and then what happened once FDR came in with an activist approach, saying that we must do more for the people. So from my perspective, we need all of that relief. And then right after we finish that, we should start talking about a big infrastructure bill. We should start talking about $1 trillion or $2 trillion in infrastructure spending for roads, for bridges, for broadband, for the needs of protecting our coastline from climate change, for the needs of the cities and towns to deal with their water issues, their sewerage issues. These are all jobs that we could create and people would go to work immediately. We have to find a plan to put people back to work. Many of the jobs which we have are going to be lost. They're just going to be lost. And we should spend the money to try to hold on to as many as we can. But then if we do, come to the worst case scenario, which is possible, let's have a big infrastructure bill. And so I guess I'll conclude in talking about the small business aspect of the legislation. We first put in about $320 billion. Then we came back and did pretty much the same thing again. It was pretty clear that minority businesses and women-owned businesses were kind of being left out, shortchanged. So in the second bill, I led the effort with a few other members to make sure that $60 billion of the money would be set aside for the smallest businesses that perhaps did not have the relationship with banks that some of the larger small businesses would have. There's still a lot of money left over, by the way, from that second tranche, maybe upwards of $100 billion. And one of the goals we have as a Democrat is to not just make it an 8-week program, but to extend it out to perhaps the end of the year so that we're more realistic in terms of the plight that these small businesses are going to be in. And so it's been a big challenge. There's been some rays of bipartisanship that have emerged. But my fear is that we might be slipping back into kind of that preset red versus blue, which is not going to be good because this is a national crisis that we're in and a national economic crisis that we're going to be in. We're all interconnected. We can't separate ourselves. E pluribus unum, out of many, one. That's the slogan for our country. That's how we have to view ourselves in this crisis. And Fred, thank you for having me here. And if you have a couple of questions, I'll be glad to take them.
Thank you very much, Senator. And we do have a couple of questions that have come in, and I want to thank you for your leadership in the battle that's right ahead of us, as you just described, and where we can be helpful through the chamber to you, and through you to Jim Cantwell. If that's helpful, just please don't hesitate to call on us. And we're happy to join that battle. It's important, and you're right. We all have to be together as one to come out the other side better than we entered it. And thank you for mentioning your honorary degree at Bridgewater. You're a son of Bridgewater State now, a fellow Bear. And not only did you give a great speech, and not everybody does this, Senator, you shook every single hand of every graduate. That's what they remember the most. Thank you for that personal touch as well. We did have one question, and I know we have a couple more coming in, but regarding the PPP program, and you mentioned a bit of it at the end there, will there be an opportunity to extend through rules changes more time for businesses to expend and use those funds for reopening?
Yeah, and that's what I was touching on there at the end. I think it's a great concern for small businesses. Those that qualified early are almost up to the end of that first 8-week period. So my belief is that we have to extend it at least another 8 weeks, but I think we should extend it out to the end of the year. So we're putting that on the table. I'm putting that on the table with the other members of the Small Business Committee. I serve on the Small Business Committee in the United States Senate. So Senator Ben Cardin is our leader on that Small Business Committee. So he and I have talked, and we agree in answer to the questioner that we have to extend it out, and we're making it a high priority. And again, we actually think that Marco Rubio, who is the Senate chairman, is receptive to this. So we're going to try very hard to put that into this next bill and extend it out.
Good. I have another related question. I'm asking for a friend named Chris Cooney. Chambers of Commerce weren't eligible for PPP. Will they be maybe potentially eligible in the next round?
Hey, Chris, I will fight for you to get it included. We've included small businesses. We've included, nonprofits up to 500 employees. In this next round, we're saying that we're putting in about putting in tens of billions of additional dollars, and we're going to allow 501c3s over 500 employees to also qualify. So it's nonprofits of all sizes, with half of the money having to go to smaller ones. But I will work with you, Chris, to see if we can't include Chambers of Commerce. I agree with you.
I guess when you're asked for a friend, you're not supposed to name the friend. I just learned that. But Senator, again, staying on PPP, the application of the PPP program to nonprofits, I'm not familiar with the application, but is there an opportunity to expand PPP for nonprofit providers? Or
yeah, it was a tremendous success in trying to help nonprofits to make it through. Not perfect, definitely not perfect, but there are a lot of nonprofits with more than 500 employees. So what we're proposing as Democrats is we include a big chunk of money, and we set it aside for nonprofits, and it's all nonprofits, as I said, with half of it set aside for those under 500 employees. But we don't want to lose, at the same time, we don't want to lose the Boston Symphony Orchestra. There are many that have more than 500 employees. So I think that if we can make the case, I think Republicans will have the similar problem in their states. You can really see who the essential workers are during this crisis. It's very clear who they are, and they're oftentimes Black and brown people, and they're taking a risk for their health and bringing it home to their family. Well, we can also see what the nonprofits do as well. The nonprofits are an essential part of the fabric of our society, and we have to make sure that we put in the funding that makes it possible for them to have the life raft they need to make it through this crisis. We don't want to lose nonprofits. They're really a part of the fabric of our society, and we were able to recognize that in the first CARES bill, the first coronavirus bill. But I think we need to continue it and expand it, because it's going to be rough when people can't have anyone go to any of their events for an extended period of time to make sure the funding is there to help them.
Senator, maybe just two more quick questions. Speaking of nonprofits, the leader of the United Way in this region, Dennis Carmen, wants to know, what can we do to support you in your efforts to help us in this region? What can folks tangibly do to be of assistance to you?
Well, you know, the United Way is a good example of an organization that has a national reach. And I think that it would be very helpful if all of the Massachusetts, all of the New England, all of the blue state United Way franchises, I guess, I don't know what to call it, but you know, those separate units, to then be communicating with the red state United Ways. You know, we need to have a way in which we're talking to people who actually have clout and are respected by Republicans in the red states to say, does this make any sense that we're going to be watching the destruction, the extinction experience for nonprofits all across the country, when we know that as soon as we come out of it, we'll be forced to try to recreate all the things that they're doing right now. So I guess from my perspective, we have a lot of great capacity online to be organizing out of Massachusetts through New England and then across the country to find the partnership with the equivalent organizations in red states. It's the only way it's going to work. And again, I don't think they're in any different position that we're in. They're going to be saying, oh my God, that could go under? Oh my goodness, that university could collapse? Oh my goodness, unemployment's going to last until the end of this year. I mean, but the unemployment checks from the federal government will only last until July. That can't be good. So a lot of this is just education. I find it with almost all issues, they go through three phases: political education, political activation, political implementation. So we have the education capacity out of Massachusetts. We have to put the activation fluid on other parts of the country. And online, we can do that. And then ultimately, implementation will be adding the language to these bills that protect all of these very important institutions.
Senator, last question, just to end on a high note. And there's a lot of challenge here, of course, and you just described it beautifully. Is there something that's come out of the pandemic for you personally or professionally that you would describe as a positive?
Well, I think I probably never would have learned how to use Zoom. I think I can say that for sure. And I think everyone can say it, and everyone can also say, why didn't I invest in Zoom last December? Who knew? Who knew it was going to become the organizing principle of our lives? You know, that's an excellent question. I think the one thing that I'm most appreciative of is how the communities have all come together. You know, when I was talking to Mayor Bob Sullivan about the medical institutions down in Brockton, and then talking to each of the leaders of those institutions, it was clear that they were all talking together. You know, that they were trying to plan together for the community, that they were trying to make sure that everybody got the coverage which they needed. And it wasn't in areas that any of them really had any previous history, because you'd have to go back to 1918. So I think it's pretty gratifying. I think we all feel this way, to just see how the communities have come together. And it's the example that's being set, which hopefully young people will see as well. You know, that we can do this, and that we're all working hard to make sure that the future is bright for them. And so I'm very, very gratified by it. And I'll tell you, I'll say another thing. I think we should all be glad that we can see who the essential workers are. We can see who the people are who can't stay home, who can't Zoom to their job at the supermarket, who can't Zoom to their job as a sanitation worker. We can see them all as we're told to stay home, shelter in place, right? And so I think I'm grateful for the fact that the spotlight is on them, and now we can say to ourselves, what should sick care benefits be? What should child care benefits be? What should the income that people kind of have a right to expect every single year, and to give them the protections which they need? So I think out of that, we can have a very good discussion in the year ahead as to what that should look like. So again, Fred, great honor to be with you. Great honor to 1 year ago be standing next to you at Bridgewater State University. And to everybody out there, if I can help in any way with my staff director, Jim Cantwell, is on. through Fred or through Chris, if you want to call, if you have any problems with the Small Business Administration, any problems with any other issue that's coming up, you just have to make a quick call. They'll get it to me and we'll be on it immediately. There are days when we receive 700 phone calls a day, during this crisis. And Fred worked in Joe Moakley's office, so you know how unprecedented that is. I want to be there for everyone who is there, and just let me know how I can be any assistance at all.
Senator, thank you for being with us. You've always been there for Brockton, for Metro South, and for this region, and we're grateful for your friendship. Thank you so much for the time today, for sharing your experience, and for telegraphing the battle ahead. I also want to thank all of the attendees. I want to thank Chris Cooney for putting this together and his staff. We want to thank Speaker DeLeo for being with us, Mayor Sullivan as well as our friends from the SBA and from the state for providing updates. And with that, everyone have a wonderful weekend. Be safe. Take care. Take care.